Hello everyone, and welcome back to KSAU Master Talk. Today we have a special guest from Iraq WHO, Dr. Zedinko Heirsig. We are excited to have him with us here in the podcast today to discuss epigenetic, a buzzword that everyone wanted to know about it. Welcome to KSAU Master Talk.
Thank you very much. Thank you very much for the invitation. I'd like to express my gratitude.
Thank you for coming. It was amazing talk today, and we are so excited to have you. I wanted to start. Can you briefly explain in a simple term, what's epigenetic?
So the epigenetics is a relatively recent but rapidly expanding field of modern biology with a major impact on our understanding and our even thinking about the biological phenomenon and how the environment regulate our genes, and then how this, when things go wrong, how the disease develops. And I'm particularly focused on cancer. That is, of course, a major health problem globally. And that's where we understanding and using the new concepts and new tools can help us to understand how the environment leads to environmental stresses leads to cancer, and also how we can prevent cancer, but also how to target, to identify and target specific changes that can lead to therapy, cancer therapy, and also early detection.
So us audience, when we hear and read about epigenetic, it did reflect in our own personal life. What about you as an expert? How did this influence your own life, your own choices? Did you change anything in your life?
So I must say, when I started, the history is quite long. I started in this area. I was relatively lonely with a few people on the fringes of major meeting, talking about this phenomenon that can help explain what genetics and our genetic heritage cannot explain. Now, looking back, what is very positive development is that now there is a recognition that the epigenetics is not only important, but it is critical for our understanding of the cancer development, but also revealing some attractive target for therapy. And the epigenetics, in contrast to in distinguishing feature of epigenetics, is that it is reversible, potentially reversible. Therefore, there is a strong interest in reversing the aberrant changes and in the therapy and even prevention. And so, for me personally, when we discovered certain impacts, so-called signatures on the epigenome as a result of exposures, I was just thinking whether this could also help us to argue with some prevention, for example, quitting smoking and so on, whether this can help us actually to, when we see this reversible change in a positive impact on our genes. Definitely. When we change, modify lifestyle, then hopefully this may help also the people to modify their lifestyle and exposures and reduce cancer risk.
Did you modify your lifestyle accordingly?
But to some extent I did, although I must say I was having a reasonable lifestyle and relatively healthy lifestyle, and with the sport and paying attention to the diet and nutrition and diet, and I think that's already a good starting point. And obviously, I quit smoking a long time ago, even before that, luckily. And
that's great. That's great.
So I just hope that this may also be used, to help design more efficient strategies for prevention.
Would we soon have a cure for cancer regarding those information coming from epigenetic, or just prevention?
I feel globally cancer burden is increasing, and globally there is of course shifts in landscapes of cancers as the society develops and evolves, and the cancer also follows this kind of patterns. And unfortunately, there is increase in cancer incidence and mortality, despite the progress in a treatment. The epigenetics offer some hope to treat and already, being targeted in specific cancer types with relatively high efficiency, and there is lots of trials on more kind of personalized approaches. And it is hoped that it will help. However, we have to really work also on this kind of prevention side. So many cancers can be prevented. And therefore, that more work needs to be done to identifying the causes and also defining efficient strategy for prevention and intervention with the aim to reduce cancer risk and cancer burden.
So you have a great journey in epigenetic research, and then you're an expert in this area. And I know all those projects, it's just like your babies. But if I ask you which one you are the most proud of? That was a difficult question, and I never thought about. You kind of surprised me a little bit with this question. It's difficult to distinguish between the babies, right? Yeah. Select one of your babies.
Yes.
That you're proud
for example, one
maybe the most challenging,
more recent one, and probably most challenging one was on childhood cancer.
Okay.
Where we managed to put together large consortia. And then combine this with international consortia, and this takes a time. And then, with high quality exposure information, with the high quality biological samples, and then combined with technology that was, galvanizing this type of research, because it's important to have the tools to be able to profile in a robust, cost-effective, and also being able to analyze, interpret data, and that's what bioinformatics come.
This is amazing. To the game. Sounds amazing.
So this, and then we published recently a couple of papers, which we feel it's a kind of a major milestone, demonstrating that, for example, looking at the whole blood samples, so neonatal samples, we can identify in one hand the signatures of exposure during in utero life, but also predictors of cancer risk. So maybe I would single out if I have this one, but again, as I said, it will be difficult to really
to choose between.
Yeah, exactly.
What is the most common misunderstanding for general people between genetic and epigenetic?
So genetics clearly is important. Is important for our health and life, our heritage. It's our genetic heritage is very important and dictates more than we think. However, it cannot explain everything, and certainly can explain perhaps a fraction of diseases. Cancer is the case. For example, hereditary syndromes, for example, breast cancer and so on, well known, very penetrant, for example, BRCA1, BRCA2. How would they explain this kind of familiar hereditary syndrome? Explain small fraction, 5%, maybe 10%. Imagine so there is a 90% as sporadic, therefore either stochastic result of stochastic event by chance or result of exposures. And therefore, there where the epigenetics come to kind of rescue, or if you like, to fill this gap of missing heritability, and also especially when we talk about environmental influences, where epigenome serves as interface between the environment and the genome, and therefore, in one hand, the epigenome buffers impact of stressors, and on the other hand, they modulate the response to the stressors. And therefore, this is relatively recent, and there is increasing evidence that the epigenetic, so-called epigenetic regulator genes, so the genes that are regulating the epigenetic modifications that are really important. These are not all necessarily, we should not consider epigenetic changes as aberrant. They are essential for development, for example.
Yes, exactly.
And therefore, their deregulation can lead to, when we deregulate, when you mutate or when you disrupt through non-mutational process as a result of exposure, then we could have a cancer development progression. And therefore, I think it's important to understand that genetics is important in terms of heredity, but also genetic change as a mechanism to introduce, mutations and so on. But the epigenetics can do almost the same.
Exactly.
can do the same. So sometimes one gene can be mutated and other alleles can be, disrupted through epigenetic mechanisms. So they cooperate and cancer development. And therefore, this is important to kind of have more holistic approach in understanding the processes that lead to cancer development and progression. And I think that's where epigenetics certainly should not be overlooked.
Definitely. Do you find it hard to get collaborating with genetics experts?
No, really, this is especially more recently. I mean, there is recognition from the colleagues that work in genetics. They also want to complement by looking at the epigenetics, and they recognize that this is now mainstream cancer research. And this was not the case, maybe 10 or 20 years ago. Now the colleagues in the genetics area, they recognize, because there is solid scientific based evidence that this is really important. And therefore and there is increasing approach, to use an interdisciplinary approach. So you have a different omics layer, not only that, but even, linking it to the population-based studies, epidemiologists, clinician, and I think that's how we can get, better picture, but also how we translate the finding, into the clinical practice, and that's for the benefit of patients.
Definitely. As a leader in the field of epigenetic, what is the most important skills that the younger scientist has to learn?
Epigenetics is more complex, as I was talking in my presentation earlier. So it is more complex than genetics. So there are different layers. They kind of crosstalk and reinforce each other. And it is more challenging. It's a code. There is a concept of epigenetic code compared to genetic code. This is a little bit more flexible, and therefore studying it, it's more complex in terms of technology that to analyze, and the bioinformatics. So the code is much more easier when it's kind of written in stone, the 4 bases, and it's you sequence, and when there is polymorphism or there is mutation. With the epigenetics, sometimes goes from 0 to 100, and then you want to know what is physiological, simply physiological response, and what is kind of aberrant threshold. And I think that is just you have to get, a little bit more tune your eye, if you like, train your eye, and then to look at this. There are all kind of tools that can allow us to differentiate, to have a cutoffs, the thresholds, to differentiate what is normal response and what is normal response as adaptation, or what is aberrant change. So there is more complexity, I would say, but it is certainly, it comes with a challenge, but it is increasingly, I would say, become feasible and widely used by different groups. And so this is, I would say, it's more complex, it's more challenging, but we as a scientist, I think we like challenges.
Yes, we do. We do. So finally, what is one simple but important takeaway message you wanted to tell to our listeners?
So I would say that since I'm working in cancer, that's our institute is focusing on cancer. So it is important to keep in mind that the cancer is neither a result of bad luck nor God's punishment. I think many cancers can be prevented. Of course, we have to understand evolving risks, but also understand the mechanism, how this is translated to the molecular levels. So my message was simply saying that we should be aware of the scientific evidence and adapt perhaps our, I'm talking about the public at large, then to adapt the lifestyle and the habits that minimize risk of cancer or other diseases, especially when there is evidence. Now, for scientists, obviously, I'm always very enthusiastic and encouraged to see interest in this area.
Yeah.
And I feel that there is important gaps to be filled, and with all the tools and the resources that you have here at the KMARC and the KSAU University, and all this fantastic ecosystem and research facilities and people.
Yeah.
It's more important people that I met with a lot of enthusiasm, but also competence and willing to collaborate and to advance science.
Thank you very much, Zdenko, for joining us. It was very inspiring, informative speech and conversation. I enjoy every moment of your visit, not only this podcast. Thank you very much.
Thank you very much for the invitation. It was a pleasure and privilege for me to be with you and discuss the science and collaborations.
Thank you. And thank you for our listener. Please stay tuned for next conversation and keep the healthy lifestyle.